Hi, my name is Ashley Wynn, and today I'm going to be talking about the respiratory tract infection that is associated with RSV. RSV is a respiratory syncytial virus. It is a common and very contagious respiratory virus that causes infections of the lungs and induces inflammation of airway passageways. It is generally exhibited in lower respiratory tract diseases such as bronchitis, which causes inflammation of the bronchioles in the lungs, and pneumonia, which causes inflammation of the ear sacs in the lungs. RSV is similar to the common cold, but in severe cases can lead to mortality. It is actually one of the leading causes of hospitalization in infants, where nearly 90% of infants have been exposed to the virus by the age of 2. The formal scientific name of the virus is the human orthopneumovirus, and is commonly known as the human respiratory syncytial virus, which can be abbreviated as HRSV and shortened to just RSV. RSV falls under the virus classification and falls within the genus Pneumovirus and species human orthopneumovirus. The virus can be classified as a spherical, asymmetric, filamentous enveloped virus covered in both G and F glycoproteins, which mediate viral attachment and entry. The G glycoproteins contribute to the attachment, whereas the F glycoproteins contribute to the entry of the virus. And it is a linear, single-stranded, non-segmented negative sense RNA, which are mostly gram-negative, and is comprised of 10 genes that encode for 11 proteins. A few of these proteins, such as the nuclear proteins, phosphoproteins, in addition to RNA-dependent RNA polymerase within the virus, contributes to the protection, replication, and transcription of the virus. It infects a superficial layer of the respiratory epithelium. RSV specifically targets ciliated columnar epithelial cells, which affects the upper and lower respiratory tracts. There are two subgroups of RSV known as RSV-A and RSV-B. Both of these strains circulate during seasonal epidemics where there's a variance in antigenic differences in attachment, and several of these strains within each of these subgroups have variability that makes it difficult to create an effective vaccine. And similarly to the influenza, there are multiple strains that circulate each season. However, specifically for the influenza, there are 3 or more strains that circulate worldwide, whereas in the strains of RSV, there's the RSV-A and RSV-B that vary in antigenic differences each season, which contributes to both of them ultimately having difficulty matching the strain for a vaccine. But in the case of RSV, it's difficult because of the variations of all the strains. And in the 1840s, there were signs of infantile pneumonia and seasonal epidemics that may have been tied to RSV. And in the 1950s, respiratory illnesses spread through colonies of chimpanzees in a medical lab, known as the chimpanzee craze agent. It was thought that these chimpanzees were transmitting the virus among themselves. However, they found out that the origin of infection was actually from the human caretakers. And it wasn't until 1965 where the RSV virus was officially discovered by Robert Koenig and was termed respiratory syncytial virus through the studies of isolation and characterization. And since then, There has been outbreaks in long-term facilities as well as seasonal epidemics. There are said to be 34 million annual worldwide incidences of acute lower respiratory infections associated with RSV in children below the age of 5. And 99% of these deaths occur in developing countries, which is due to the fact that they don't have the same healthcare that we do in the US and could obtain the treatment as well as medications. In the US, there are also saturated numbers of RSV individuals or RSV infected individuals that contribute to hospitalizations, outpatient visits, deaths, and ultimately the saturated numbers increase, especially during the seasonal epidemics. However, the mortality rate, it's less than 1% and less than 500 deaths per year. There are recurring seasonal outbreaks of RSV that typically occur between the months of October all the way to May, and typically peaks in the months of January and February, which are similar to the flu outbreaks. And this is associated with the temperate locations and their winter months, as well as tropical humid locations and rainy seasons, which are conditions that contribute to increased replication of the virus. And this suggests the climate's role in RSV epidemic. And there has been outbreaks in long-term care facilities in the past, with various reports of outbreaks in nursing homes. And this is partly due to the close populations of these individuals where the virus is subject to nosocomial spread. In addition to this, there was a failed RSV vaccine attempt in 1967, which resulted in an enhanced form of RSV in vaccine recipients, where the recipients actually died from the vaccine. RSV is transmitted through contact transmission, vehicle transmission, and droplets, and it is mostly transmitted through contact transmission. Individuals can also be contagious 3 to 8 days whenever they have come in contact with the virus, and can continue to spread the virus up to 4 weeks after symptoms have stopped. Individuals who are at high risk and are more susceptible to becoming infected with the virus would be individuals who are above the age of 65, those who are immunocompromised, as well as children under the ages of 5, and most of the children below the ages of 2. Some preventive measures that can be taken but are not limited to just these are washing your hands, avoiding close contact with individuals who are sick or infected with the virus, and conducting proper social distancing in addition to cleaning and disinfecting surfaces. Symptoms of RSV are similar to the common cold, such as fever, sore throat, headache, coughing, difficult breathing. But typically, since there are increased cases in children, especially children under the ages of 2, there are more extreme symptoms such as fingers and lips appearing blue, as in addition to irritability, and the fingers and lips appearing blue indicates low oxygen levels, which can be very severe, especially in babies who can't identify the changes in their breathing. And diagnostic tests such as blood and urine tests, chest x-rays, swab of secretions, and pulse oximetry can be conducted. There are no vaccines or specific treatments for RSV. However, there are preventative measures such as palivizumab medication, which is a monoclonal antibody prescribed to high-risk babies to prevent serious complications. And it neutralizes and suppresses replication of the virus and is given to these high-risk babies monthly, especially during the peaks of the RSV season. Other treatments could be self-care measures, over-the-counter medications, or in severe cases, oxygen, IV fluids, or medications to open the airway. And in regards to research efforts and future outlook, there has been increasingly recognized as a major cause of childhood morbidity and mortality globally, and it's increased awareness of contributing to the development of candidate RSV vaccines, where there have been RSV vaccines attempts that have reached phase 2 and 3 trials, but partly due to the variants in the strains, it's been difficult to develop an effective vaccine. However, the future development of vaccines, it's still being conducted. And these are my references. Thank you.